that's perfect now. Yeah, thank you.
So, morning, everybody. My name's Amraze Khan. I'm the Head of Equality, Diversity and Inclusion here at Pennine NHS Foundation Trust. I think my presentation is going to be slightly shorter than Uju and Helen's, but I just want to talk through some of the work that we're doing and how we're doing it. And I think just to begin by saying that we're on a journey ourselves, and we know we're not perfect. We've got quite a lot of work to do. But we're excited to be part of this project. I'm very new in post. I joined back in September, so I'm really excited to be involved. And a big thank you to Dominique, our QI coach, who's doing a fantastic job with us and always really, really supportive. So similarly to Uju and Helen, I just wanted to, I think some of the things that we're doing are quite similar. So it's always quite nice to see that we are in line with what everyone else is doing. And, the comments about the Jamboard, it's similar to what we had when we started as well. So quite reassuring. So just a very quick breakdown. I won't go into too much detail about this, but it's always nice to know about the organisation that I'm presenting about. So Pennine Care, we're based up in the north in Greater Manchester. We provide mental health and learning disability services to 5 key boroughs, so Bury, Harewood, Middleton and Rochdale, Oldham, Tameside and Glossop and Stockport. We're serving quite a large population of 1.3 million in the Greater Manchester area, with about 3,600 members of staff and about 132 different mental health and disability services in total. So quite a big trust here in the north. So similarly to what Uju and Helen had presented earlier, we've developed our own project board. We've got a sponsorship from the Exec Director of Nursing, Quality and our Deputy CEO. Membership also includes Director of Workforce. We've got a number of non-executive directors on the project board as well who have an interest in this area, who also have experience of working with local communities, which has been so good and so valuable for us and insightful. Our medical director is also part of the group, and we have a role of head of patient involvement and service user engagement, and they support a lot again with that service user element, because we're quite keen, as I'm sure many of you are, to develop those voices from our community and make sure that they are heard, and we're working collaboratively. I mean, it's not just us sat behind a desk making all the decisions about this work. It's so important for us to collaborate, to talk to and listen to and engage with people, which is so important. And I'll talk a bit about this later, but we are developing lots of work with our service users, and we are actually paying for service users to be part of this project, because we feel we really need to value their input and their lived experience. We're looking at having 5 service users, between 3 and 5 on our project board from different communities and backgrounds, and we're paying them £10 an hour. So we're hoping that they'll be involved with the project board. They'll receive support from myself as head of EDI to make sure that they're supported and they're helped, and the voices are really truly heard. And I will talk about that our community engagement very soon, and happy to take any questions at the end. So progress to date, we have had 2 project board meetings, similarly as I mentioned to the previous slide. Our initial meeting, I think, happened before I joined the trust, and I've been asked to take lead with this project now going forward, which is quite exciting for me, and I'm really keen to work with people. And our recent project board meeting, we did some breakout sessions, the Jamboard, as I again mentioned previously, which was quite quiet, but we shared the link out with everybody and gave them a couple of weeks to look at it, and we got quite a lot of comments over the couple of weeks from the project board on that, which was quite good. I think we struggled, and we are still thinking about how we're going to bring our populations down to 3 populations as a part of this work. We recognise there's lots of different populations we'd like to work with. And I know Dominique, our QI coach, sort of mentioned, you could, obviously this project has got 3, but that doesn't stop us from doing a similar project again in the future, and we could focus on other populations as well. But so far we've got 5 populations that we need to obviously break down into 3, and so far those populations are Black, Asian and minority ethnic population and communities, our LGBTQT plus community, people experiencing substance misuse, our homeless people in the area, and military veterans. We've got a massive military veteran support service here at our trust, so we're really keen to have them as a part of our populations as well. And we've developed a wide range of an engagement plan, which I'll talk through very soon. It was really important for us that I think what we sort of feel as a project board is that although we're making decisions, we're thinking, we're bringing in service users very soon, but we felt as though we can't make all the decisions on our own, and we do want to do lots of engagement. We're doing want to do sort of staff engagement, community engagement, but also service user engagement. So those as three sort of distinct ways of engaging with people and distinct target audiences. So we're quite looking forward to that. Our data is continuously under review, and again, I'll talk a bit more about that when I come to the community engagement. I think one of the challenges that we face is understanding where good quality data is within the organisation, how to bring in and find good quality data. So I was really keen on watching quite closely of how Helen and Anuju talked about their data collections, which was really useful for me. So something we can take back as well. And as I mentioned before, that service user involvement and engagement, which we think is very, very important, is due to be finalised very soon. So in terms of engagement, as I mentioned, we sort of broke it down into 4 bits here, but staff, service user, community and stakeholder engagement. With the staff engagement, we are quite keen to talk to our frontline services in particular about which communities they're working for, working with, and we feel they'll know quite a lot about the local population in their area. So we're really keen to talk to them directly. Some of our frontline services also go to a number of different groups and community groups and networks and forums. So we have set up lots of work with them. So as you can imagine, our comms and engagement team, we've been keeping them quite busy with all staff emails going out to staff, stuff in our regular communications, as you'd expect, with internal comms, and our intranet pages have been updated with all the health inequalities work. We also did a health inequalities session in October. It was a lunch and learn session which I led on. We had quite a few people attend that, and we talked about the AMHE resource and the work that we were doing there to really sort of give people the context and understanding as to the work that we're going to do, which was quite useful. But we have set up lots of virtual sessions over the next couple of weeks with staff, morning, afternoon and in the evening as well, so people can come along. We are also going to be looking at doing face-to-face sessions after the new year, so again talking to people directly. I'm attending team meetings. The all manager email that went out really got a lot of interest in this piece of work. So lots of team meetings, project meetings, service level meetings, network director meetings, attendance, and talking to them about this as well. We are looking at doing a survey with staff as well, possibly to again get those views and thoughts of what they think and feel. And we will be linking in with our race equality network here at our trust, which is doing some amazing work so far. So that's our sort of staff engagement piece as it stands, and that's the next thing we're going to do. And I think we, like I said, we want to ask staff about where they think the data is, or if they've got any connections with the community. And also our trust, we're doing lots of different great bits of work across the organisation. So to bring that together, there's pieces of work happening with military veterans, as I mentioned before, and people experiencing substance misuse. So we'd like to bring that in from the different services that offer that provision. In terms of service user engagement, I mentioned earlier that we're going to have 3 to 5 service users on our project board, that we're going to pay them to be involved. We are also looking at having a bit of a service user panel from people from different backgrounds, communities, and our diverse communities, to ensure that their voice is heard, that they're part of the work that we're doing, and that you know, we're working collaboratively with them. And again, that'll be paid for by the budget that we do have here. So really keen to build that relationship. We've also got a stakeholder database across the organisation, so we'll be focusing on that too. And like I said, there'll be lots of involvement from our staff around the services and where they're working. But in particular, we are doing a trailblazer piece of work at the moment, which is going to feed into the AMHE work. So in Oldham, don't know if many of you know it, in the Northwest, it's a very diverse area. There's lots of we recognise and understand that there is poverty in the area as well. So we are developing some work separate to AMHE, but we believe it will feed into the AMHE work, where we're working with 2 local community groups to do some mental health champion work with Pakistani Bangladeshi communities, who we believe we want to focus on with the AMHE work. So doing some mental health champions work to help make preventative measures there, but also gain some trust and work with that community, which I think will be really fruitful and helpful for us with that community engagement perspective as well. In terms of stakeholder engagement, we are working quite a lot with our partners. We're going to lots of partnership meetings. We have the Greater Manchester Partnership EDI work and EDI work streams here, which were really useful to link in with. We also get gathering data from our local authorities and building service user makeup as to what the different boroughs look like. We recognise there is a census and the joint needs strategic assessment, but we want to build sort of profiles for our groups ourselves and understand what the service user population looks like. So there's lots of exciting work that we want to do. Like I said, we want to, like Uju and Helen mentioned earlier, it's about working with the communities to ensure their voices are heard. We're quite linked in really well working with our QI team. I know one of the colleagues is on the call today, and there's lots of initiatives and ideas that we're doing through that as well. So we feel that once we get the engagement done with staff, we'll then be able to develop down to our 3 main communities that we want to focus on and start pulling together that data together in terms of next steps. And in terms of next steps, like I mentioned, we want to further develop that engagement. So staff engagement is in progress, but there's the other 3 areas that we're hopefully going to do after the new year. Service user involvement will hopefully be agreed and developed very, very shortly to bring them on the work that we're doing, and review our data. And as I mentioned, sort of agree that next steps with our business intelligence team, our research and innovation team, and look at how we're going to bring that into the work. I think one of the things that we face, the challenges we face, is that everybody, you have to have a really sort of specific focus on your population. I loved when Uju and Helen mentioned that specific focus. And I think with those guys, we can become quite general, just so really looking at what do we want to focus on and who that, who we want that to be. So really, really keen to get that and get the populations agreed as well. So quick whistle stop tour there, Tom. I'm happy to take any questions, and I will stop sharing my screen.
Thank you so much for that. So I was just thinking during your presentation that one of the dangers, I think, or one of the potential pitfalls of doing the AMHI work is that it becomes a project that's done sort of over here in a trust or in an organisation, and then the business of the organisation is over here, and it's not kind of knitted in. And I was just thinking about how important it is that you are doing the work you're doing really to build the foundations for the project. So really kind of knitting it into things that are already happening in the trust, work that where there's already a focus and a priority, thinking about how you engage with staff, really important, and kind of get that the governance of the work embedded into the work in the trust in a way that feels relevant to the trust or the organisation. I think that's the foundation that will enable it to succeed. So really great to hear that, and I was really pleased as well to hear the focus on paying for service use and substantial service use involvement in the project group, and that's paid. So it's it's really great to hear that, and there's a couple of comments in the chat as well about saying similar things, I think. I'm going to just wait to see if anyone has a question they want to raise their hand for, or if not, we'll perhaps move on to the next.
Don't worry, I don't mind being let off scot-free, to be honest.
I wouldn't call giving a whole presentation being let off scot-free. It was great to hear it, and really, Isaac's raised his hand, so you haven't got off scot-free after all. So Isaac, over to you.
Hiya.
Be nice, please be nice.
Hi. So really important that it's the responsibility of everyone in the organisation to make this work happen. How do you think that you're going to be able to make this sustainable whilst trying to always include people in terms of co-producing? Because the two can often be at kind of loggerheads with each other.
Ooh, what a challenging question to answer this morning, and it's only 10:45, Isaac, so bear with me as I try to maneuver myself through this. I think in everything that we do here at our trust, we are fundamentally ensuring that people's voices are heard. I think it's so important that everything that we do, and I think we've got a really good board our trust board, who are really invested in this particular project, and everything that we do and say, the first thing we ask is, how are service users, how are they involved, how are staff involved? Because we don't want them to feel as though we're making the decisions on their behalf, not involving them or doing things to them, and that's the last thing we want to do. So I think sustainability is hard, as I mentioned, and sometimes it can be a challenge between the two, but we do feel that we sort of go with that service user, and that sort of involvement piece is at the core of everything that we do. So I do think sometimes, if it feels as though it's challenging, then we have a really good discussion, we think about it and we talk about it, and we speak to the groups and communities to involve them. So I don't know if that's a bit of a rant or I'm just talking about nothing, but yeah, you're happy, so it's fine.
It was neither a rant or about nothing. It's great to hear, thank you. There's a similar question from Chitra in the chat as well about balancing the day-to-day challenges of teams against the large QI projects. So, which I think is a similar answer perhaps, but it's going to be a continued challenge, I think, for the work for everyone. But I think my suggestion is to try and actually this work is the day-to-day work of organizations. So and I understand that not everyone will perceive it that way, but I think that the improving the quality of services is the day-to-day work of organizations. I think you can't do that unless you're addressing inequality. So for me, that's the answer. I know it's easy for me to say that, easier to do than it is to do.
No, I agree. I think we're really lucky, like I said, that the board is really in tune, and all our network directors for the different networks that we have out there, they are really, really keen to be involved with this work, because we've got a number of them involved. So that helps when you've got the senior buy-in to support staff. And often I do get a question, what does AMHE mean? So we have a really good discussion and people seem to be on board with it.
Okay, that's great. Thank you so much. Right, I'm going to